Hello, everybody. Welcome to FII. They say that health is wealth, and for some, those words go together in more ways than one. Here, healthier capital, that's what we're all looking for, isn't it? And as luck would have it, that is the name of our special guest's organization. I am, of course, talking about the inimitable Amir Dan Rubin, who, at one point in his career, led One Medical through an extraordinary few chapters, including its flotation and its acquisition by Amazon for $3.9 billion. Today, a different hat, an investor, healthier capital, deploying money into some very entrepreneurial teams indeed. FYI, please welcome Amir Dan Rubin.
Thank you.
Very good to see you, Amir. How are you?
Ali, pleasure to be with you. This small, intimate group, you're going to be healthy and wealthy. You chose right.
You chose wisely.
Since we have an intimate group here, we could be very one-to-one here.
And we're going to get that. We're going to get the heartbeat up because we're going to move swiftly. Amir,
yes,
stand by.
Absolutely.
So I want to talk to you about problems. I want to talk to you about the opportunities you're investing in. But first, I want you to help us remember some of the whistle stops you made through healthcare.
Yeah, thank you, Ali, and pleasure to be here. And it's been an amazing week at FII, meeting incredible people. So I've spent my career in healthcare leadership. I was the chief operating officer at UCLA's health system in Los Angeles. I then went to be the CEO at Stanford University's health system in Palo Alto. Then I went to become executive vice president at United Health Group, Fortune 5 company, mostly in the States, but some activities abroad in their Optum division. And then I went to a startup, One Medical, modernizing the doctor's office with digital health and in-person care. As you said, we did an IPO, and then for a year was part of Amazon, lifting boxes on and off trucks, just kidding, after Amazon acquired us. And so now in the US, One Medical membership can be added on to your Prime membership for $9 a month.
Hugely helpful primer. Thank you very much indeed. Right, so that's the background. Now, we're thinking about so many different stakeholder groups right now when it comes to health and tech. Yes, we'll talk about ideas, but let's talk about problems. What are the biggest ones worth solving right now? What do you see?
Yeah, I like to divide the problems, Ali, from the demand side and the supply side. So if we think about the demand side, let's start with the consumer, the patient, the member. And many problems there, but let me simplify. Access and experience are difficult. I need care, I want it easily, I want it at low cost, I want availability. Sometimes I talk about the 5 A's of access: accessibility, availability, affordability. Does it accommodate me? Also on the demand side, we look for those who are often sponsors or paying. Health insurers, governments, they want to cover people, but with value. They want to make sure they're getting return on their payments. And if you're an employer, you also want to make sure your employee's showing up to work. That's partly why you're offering insurance. And then we have the problems on the supply side. We have, over the next 10 years, about a 10 million person shortfall globally in healthcare workers. Doctors, nurses, clinicians. So how do we find these people? We find huge levels of burnout in the existing workforce. Tons of demand, tons of wait times, people in the hallways. So how do we deal with that issue? And then finally, how do we coordinate care? A lot of healthcare is disjointed, and it's on the consumer, on the patient, on the family to navigate healthcare. So these are some of the problems that we're seeing in the healthcare ecosystem.
So joining those dots, making sure we've got the people, or maybe the humanoid robots, we shall see. But then first and foremost, access, which of course is a global issue. How important is it when you're thinking about who to invest in, we'll come more to this, that this is a potentially global company? Because let's face it, you've got a huge market right on your doorstep in the United States.
Yeah, I think the problem statements are pretty common globally. I've had the privilege of touring a lot of the Saudi health system, and very, very exciting redesign happening here in the kingdom and across the world. You really have similar problem statements. So I think those problems are global. The way health systems are organized, I spent time in the UK, slightly different, but same problems.
So the interesting bit is you've walked the talk on this because you have solved these problems. Let's have the example of One Medical. How did you turn those problems into solutions? And just let's zoom into that.
Yeah, so One Medical tried to modernize the primary care, the general practitioner, the front door experience, and solve each of these stakeholder problems. So on the consumer side, we said, gee, the consumer wants to talk to somebody 24/7 with no payment. at least at the margin, and with a very quick response. So that's what we did. We created a membership, and for $9 a month, you could have unlimited conversations, video chats, or asynchronous messaging. And then we built these lovely offices. They take insurance. They're in retail locations, and you can get an appointment same or next day. You know your provider on a first-name basis. It's half-an-hour appointments. So we created a 90 Net Promoter Score, incredible patient experience. And then we went and said, gosh, to grow this as a business, let's go to employers and say, hey, employers, if you sponsor this membership, we'll take insurance, we're in network, but if you sponsor this membership, we'll show we can keep your employees more productive. And then we had a great paper published in the Journal of the American Medical Association that we took down costs for one employer, 45%.
Yeah, got it.
And what we saw was 30 to 40 to 50% reductions in emergency room visits and specialty referrals and hospitalizations. Why? The consumer had frictionless access with no cost at the margin to talk to primary care. It was the easiest thing to do. And then on the supply side, we took the providers and said, instead of paying you a fee for every visit, which incentivizes you to have a lot of visits, you'll have straight salary. So these primary care providers have straight salary. Instead of having a 10-minute appointment, you have 30 minutes. So you can deal with a lot of the specialty care, the COPD, the CHF, the diabetes. And then we built our own technology platform, our own electronic health record, that showed it had about 58% less clicks and tasks, and I could come back to that, than physicians would have in other systems. And then finally, we built interfaces with the existing electronic health records, laboratories, pharmacies, so we could help own that navigation.
So it is that streamlining. So given now, partly in the wake of deals like Amazon and One Medical, what do you say to entrepreneurial teams who might be being told by potential investors, forget it, Amazon's going to do that now, Google's going to do that now, why start the race?
I don't think writ large those big tech companies will do all that now. I mean, at some level, Amazon bought One Medical. Couldn't they have done it? You know, there's a lot of idiosyncrasies in healthcare. You have to understand, just in the US, Medicare, Medicaid, commercial insurance, FDA, brokers, different compensation systems. And so I think what you'll have with the big tech companies is you may have some solutions like One Medical, or Amazon now has pharmacy and can deliver pharmacy. But probably the bigger opportunities for them is like on the AWS or the Google Cloud side, power those
together,
things. And then what we're seeing as investors at Healthier Capitals, we're then seeing companies say, okay, I could leverage cloud compute, large language models, but then how do I adapt that to make the semi-automated nurse or semi-automated doctor or the more efficient insurance system?
Yeah, somebody said yesterday, we asked them, FII 18, so in 10 years' time, who will the biggest names in health be? And of course, being an entrepreneur, they said, we haven't heard of them yet.
I like that. That's interesting. And I think, you know, it's not a winner-take-all in healthcare. Again, just touring with the Ministry of Health, virtual hospital, a lot of really exciting things happening here in the kingdom. Same problems, similar innovative solutions, but you have to navigate every ecosystem in its own way.
Right, and on those systems that I want to focus a bit, but let's look at it through the lens of Healthier Capital, okay? Because I want to fire up our guests' minds with examples of different models, different ways of doing things. So where are we going?
Well, I think back to those problem statements, I think we could really help increase that access to the consumer side and significantly improve the administrative and clinical workflow. So let me use a couple examples. I'll use a One Medical example, and then I'll use a portfolio company example. So at One Medical, we have all this unlimited messaging to your doctor. How do we handle it and not overwhelm the doctor? We had first built a natural language processing layer, now using generative AI, that reads all those messages. And 2/3 of those messages didn't need my doctor to respond. I need a referral, I need an authorization, my prescription didn't go through, where do I park, where do I go, can I get a follow-up? The NLP was reading that, and then we'd route that message out of the in-office clinician's inbox. We had a 24/7 digital team that not only did synchronous video around the clock to patients, but also handled those asynchronous messages. Then we put generative AI in the loop, that training big models on our kind of reinforcement learning and our own kind of small models and our own data. With the responses, we kept a human in the loop. oh, so sorry about to hear this, Mr. Rubin. Absolutely, we could send your prescription to here, 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 and here.
So the AI is superpowering.
Superpowering, taking off those administrative tasks. So now as we look at investments, we're seeing these kind of opportunities across the healthcare ecosystem. For example, we're looking at a company that's doing kind of the customer support for health systems. They're in several large health systems in the US. They're handling 85% of the calls.
When you say handling, what do you mean?
So today I might call a contact center, I might go message some people. It's in real time answering that. And so it's using LLM technologies to understand the language. It's then building a knowledge graph, basically ingesting the information from the local health system. So it doesn't tell you to park on the wrong floor because it randomly pulled that off the internet. This is our health system's information. And then in voice, it could talk back to you or in messaging. And the interesting things about these technologies, and this is why, back to your other question, it's not just about the LLMs and generative AI. They've interfaced with the legacy systems, so it needs to talk to Epic and Cerner and CVS and Walgreens and Avaya and NICE and Amazon Connect on my phone systems. It needs to talk to Salesforce because most of these systems are complicated.
It needs to become that translator, right?
Correct. It needs to own that complexity.
Yeah. So super briefly, and then I'd love to flash up another example. Just remind us why we should be reassured about what you're saying, given on the front page of ChatGPT, it says ChatGPT may make mistakes. That's not what we're after when we're dealing with our health. Just remind us how we square that circle.
Well, I think it's going to all be on the applications of these technologies. So let me tell you another example company. We have one that's using AI to reduce the time in the MRI scanner. So what's it doing? You go into any MRI scanner, it then opens an instance of software, and it basically cleans up the image, kind of like your phones are doing. And what's happening there? It has a library of hundreds of thousands of images, and it's comparing your image to these images. So at some level, Ollie, would you like a human to read your image, and maybe they had a long night, maybe a lot of after parties at FII, they're reading your study alone? Or would you like a computer to compare it to a few million images?
And to your point,
and
I'd like them to join forces, Amir.
And probably to join forces, right? And so, you know, it's often going to be augmented intelligence, also because of regulatory issues. But for example, this company, it's FDA cleared. They had to do studies, they had to have radiologists, they have to have blinded A/B tests and demonstrate
And the knock-on effects. A family member recently told, we'll have your scan results in 5 weeks' time.
Oh,
that's a long 5 weeks.
That's extremely typical, and it probably took 3 months to get that appointment.
Yes, it did.
So what if, like in this company, we can double the throughput of an MRI center because we could shrink the time in half?
So how about our message to entrepreneurs? You're seeing, I dread to think how many plans, meeting how many entrepreneurs. What are you looking for in the HealthTech Entrepreneur of today?
Well, I think we're particularly investing, let's call it in health tech, the intersection of the healthcare problem statements we talk about and these technology solutions. So I think we have to see expertise and knowledge on both. It's not enough, and we've seen a lot of these companies. I worked at Google, I worked at Apple, I wear jeans and a t-shirt, which I usually do back in Palo Alto. That's not enough anymore. You need to understand Medicare, Medicaid, commercial insurance, health system, government regulation, FDA, and the equivalent around the world. So we look for knowledge of that combination.
So in the absence of a non-medical co-founder,
it's less
would
about,
you invest?
We might. It's less about medical or non-medical, but it's not being naive to these problem statements because distribution is very hard in healthcare. If you're going to sell into a hospital system or a government or into a nursing organization or into a health insurer, they're going to spin circles around you unless you understand how to navigate.
Exactly on that, talk about models. Any other red flags? You say, been there, done it, that is troublesome for us.
Well, I think generically, one also has to think about, I like to think about back to those stakeholders, and are we trying to solve for all of them? I don't like the zero-sum game. I don't like the doctor loves it, but the insurance company hates it. Or the consumer loves it, but the doctor hates it. Then you're swimming upstream. And so I think often in healthcare we're disrupting from within because we have to be careful. We have to be careful about safety, it's people's lives. It doesn't mean you can't have some radical transformations, but frankly, if you think about the bigger breakthrough companies in healthcare, they've been able to navigate through that ecosystem.
And is there anything on that you think, because we're surrounded by some of the most sort of leading tech journalists in the world, we follow the latest developments, anything that might be underhyped, might not be sexy, but it's very, very important and interesting?
Well, let me reiterate the hype that you probably hear somewhere else. We have the technology to put a clinician in your pocket. I've looked at companies today that doctor-patient can talk, and it's basically, it's giving advice to the doctor because of regulatory, but right now it's saying, I think it's this, I think it could be that. It's ingested every medical textbook.
Yes.
Now, what it doesn't know is what the patient didn't say. This is where the humans are like, you know, oh, he's sitting like this. I wonder if he's not telling me something, right?
Yeah.
But even that it can infer through computer vision and the like. So that technology is here today, and the ability to automate workflow is here today. So my hope is we can create tremendously more access around the world at lower costs and at less burdens for our healthcare workers, because we don't have enough of them, and we don't have enough access.
So let's finish on that, what you don't have enough of. What would you like to see more of if you're putting out a call to the entrepreneurial teams? Because frankly, we're seeing founders come into this space at a rate of knots right now.
Yeah, it's incredible. So I'd like to see on both those sides, on the demand side, easier access for consumers and different models, right, at different price points. I think that's okay. And here's where I think the global market is really interesting. There might be things you can do in one country versus another. For example, I'm not sure the US might be the place where some of the technology grows first, just because of our complex state and federal regulatory environment. For example, here in the kingdom, you have a single regulatory environment.
So you might even come here first.
That might be a tremendous opportunity. Now you have a big market here and a lot of growth. You know, if you think about the UK or European countries or Asia or Brazil, there's multiple markets. So I think addressing the consumer needs and then the supply and workflow issues. If we can automate the bureaucracy, I mean, at some levels in the US healthcare system, we say between 35 to 50% of it is waste. That much. So if you can now automate that process, ideally you would redesign it and eliminate it, but at a minimum, if you can automate it, I call it war of the robots between the providers and the insurance companies, you could at least remove the humans from that and focus on health.
Well, whatever happens, please let us not automate authentic leaders who are prepared to share their journey, connect the dots across what can often be quite an inaccessible industry, help make things easier to understand, and keep doing brilliant things. Amir, Dan, Rubin, thank you very much indeed.
Thank you, Ollie. Thank you. Thank you, everybody.
Thank you, Amir. Thank you.